Hi, it's Erin from Erin Smith Antenatal and Baby Massage. The video I'm sharing with you today is about how to use active, upright movements and techniques during your labour and birth, and specifically looking at birth balls, or also known as gym balls. They are really versatile, and it means that you can try out lots of different positions and importantly movement during your labour as well. So using a birth ball and using it in the proper way can mean that you are remaining more upright in your labour. So you're helping to use gravity to help manoeuvre and move your baby down further into the pelvis. That you can use movement such as rocking and swaying, and again changing positions to help change the shape of the pelvis, but also importantly helping to keep your pelvis open, and also a support for your perineum as well by using the right different positions. So the first things to consider is for when you're sitting on the ball, which is a really common position, and some women do find that they use balls instead of chairs when they're working as well, is by making sure that the ball is the right size for you. So what a birth ball should do is allow you so that when you're sitting on it, that your knees are going to be lower than your hips. So our positions that we're looking for and that are wonderful in labour and birth are upright, forward and open. So UFO is a great acronym for helping you to remember that. So if the ball is the right height, your knees are lower than your hips, which means you sit tilted forward, which is not only great for helping to relieve lower back pain and also pelvic pain, but it's also meaning that you're starting to tilt your pelvis open, so that in itself can help encourage your baby into an optimal position. So this is a great position. It's making sure that you feel supported, you have your feet firmly on the floor so you feel supported in that way, and you're upright, and as you can see, you can move in circles, you can sway back and forth, and it's all about using those different types of movement for your comfort, but also if you're feeling and experiencing contractions, it's another coping mechanism for them as well. So other positions that you may want to use is actually leaning over the ball. Now there's a few ways that you can do this. You could place the ball onto something such as a chair or a bed, and then just kind of lay your body across the ball so you feel supported, you feel comfort, but also, as I say, you're moving your body in a slightly different way. Another way that you can do that is by actually placing the ball onto the floor, so it's lower down, and then as you're kneeling, remember you can use cushions as well for your comfort, either on the floor or even a cushion or a towel over a ball, means that as you're getting hotter and perhaps sweaty in your labour as well, that you're not going to be sticking to the plastic of the ball. But again, leaning over in where you're keeping your pelvis open, but also, as I say, you're using all of that movement, and how then you move your body is completely up to what works for you, such as that. Positions where you are leaning forward as well gives a birth partner access to your back, so they can massage your back, perhaps for relaxation or even for pain relief, but also they can apply pressure in your lower back, and which is a technique that some pregnant women really do find helps during their labour and birth. Another position that people don't always think about so much is actually squatting in their labour. So again, there's a few ways that you can do that. You can find that by placing the ball against the wall, it gives you support. So one way that you could then do is by squatting, you really feeling your pelvis opening, but then leaning means that that ball is not going to roll off somewhere, so you do feel a little bit more secure. The other way that you can squat is using the ball as a support for your back. So by squatting, leaning against the wall, in a way at a height that does feel comfortable, but keeping your legs apart, leaning back, and then most importantly as well, keeping your feet flat on the floor, because what you don't want to do is cause any extra stress or tension on your perineum as well. So as I will say, you can lean back, you can move and sway, especially with those contractions as well. You can also, which some people have used before, you can directly use the wall, but some women actually like to use the ball and lean against the wall as well, because I say because of the round shape of the ball, it really does allow for movement also. So your birth ball can be used in so many different ways, not just for sitting on. And the more that you can open your pelvis and also open it in different ways, you're going to be helping to encourage that movement, that transition the baby is making. So whilst you're kneeling in front of your ball, what you can also do is change the shape of your pelvis by even raising one leg either side, and you can change that leg as that knee or as that leg begins to tire, but also it's opening that pelvis in a different way. And again, you can lean that bit further forward. So it is really handy to have during pregnancy to help ease those different back pains that you may be getting, but also to help encourage your baby into a good position, ready for labour and birth. And then it's a really, really good tool to use during your labour and birth as well. So we'll be sharing some more tips with you for other techniques that you can use and that you can try. So come and have a look for another video soon. Take care, bye-bye.